Hi there, and thank you for joining me for this presentation entitled Analysis of Medical Student Sleep Using Wrist Actigraphy, conducted by myself, Ryan McIntire, and Dr. Jennifer Volberding. Sleep is an extremely important aspect of human health as it regulates a lot of metabolic and physiologic functions of note. It helps regulate circadian rhythm, so the release of our hormones throughout the day and throughout the night while we sleep. It's important to maintain good physical and mental health, and then it's extremely important for recovery for neurocognitive function so that we can be alert and attentive the next day. Regarding sleep and medical students, studies have shown that 77% of Saudi medical students reported poor sleep quality and 63.5% reported psychological stress. Additionally, almost 51% of medical students in the United States reported poor sleep quality with a Pittsburgh Sleep Quality Index score of 6.37. And lastly, the prevalence of poor sleep and sleep deprivation is higher in medical students than in non-medical students. The primary objective of this study was to evaluate medical student sleep metrics using wrist actigraphy. So we wanted to answer the question, are medical students in the United States sleep deprived? Further, a lot of the literature that we have found is that's specific to medical students just use surveys and health questionnaires. There's not a lot of data out there using objective measurements, so like using polysomnography or using wrist actigraphy to measure sleep quantity or quality or anything like that. And really overall, there's a lack of study in the United States. A lot of the literature we found the studies were conducted in other countries. For our study, we used the Fatigue Science Ready Band, which is a device that has been shown to be 93% accurate when compared to polysomnography. And then Fatigue Science also has a patented algorithm called the Sleep Activity, Fatigue, and Task Effectiveness Model, aka the safety model, which is a biomathematical model that estimates alertness and cognitive effectiveness based on the previous 72-hour sleep-wake cycle. And here, this is just an example of the data that we get once we sync these devices back up with our computers and push them through the safety model algorithms. And here's another example. So this is just a sample from the study here showing the summary from the 2-week period. Here in the bottom right of the PowerPoint, you will see that this is what the Ready Band looks like. So for the methods for the study, we conducted an observational study with 30 medical students over a 2-week period. So these 30 students wore the watch for 2 weeks, and they were instructed to wear the watch as much as possible without getting the watch wet. And the Ready Bands collect a lot of data, and the Fatigue Science analytics software actually gives us a lot of information, but we chose to analyze the safety scores, the sleep quantity in hours, the sleep quality, which is a 1 to 10 scale, and then the safety scores categorized as risk zones. And those safety scores are a 0 to 100 scale, with 100 being the best and 0 being the worst. Looking at our first set of results here, we've got the means and standard deviations for some of the sleep metrics that were recorded by the Ready Bands. So the first column here, we've got the safety scores, 0 being lowest estimated cognitive effectiveness and alertness, and 100 being optimal, the highest cognitive effectiveness and alertness. And just of note for the students in this study that the mean for each class was all below 90, and we're really looking to be in that 90 to 100 zone. And for sleep quantity, so the recommended amount of sleep for adults is at least 7 hours. And as you can see here, the means for each class were all below 7 hours. Here we've got a graph showing us the percentage of time spent in wrist zones per academic year in medical school. So our first column over here, we've got the first-year students going over here to the fourth-year students on our right. And then our legend here shows us that Fatigue Science categorizes our safety scores into risk zones, ranging from low risk zone, which has a reaction time slowed by 5%, a 0% blood alcohol content equivalent, down to our very high risk zone with reaction time slowed by 100% and a BAC equivalent of over 0.11%. Looking at these results, so the second year students spent 48% of their time with the 2 weeks in the low risk zone, so that's 90 to 100 on the safety scores, and then the first and fourth year spent less than 44% of their time in that low risk zone. And overall, each class spent about half or more of their time below the low risk zone, so in those moderate to high risk zones. And then further, each class spent about 10% of their time on average in the elevated and high risk zones. The results from our study on sleep quantity, so the amount of hours of sleep per night medical students are getting, supports previous literature with their suggestions that medical students are sleep deprived and are not obtaining the recommended hours of sleep per night, which again is anywhere more than 7 hours per night. Further in discussion, our study showed that second year students demonstrated the best sleep metrics. So here this is a screenshot from the Fatigue Science Analytics page showing sleep quantity and sleep efficiency and time in bed of the second year students in the study. And then third and fourth year students had the worst sleep metrics. So in the bottom right, we're showing the sleep metrics from the third year students, and bottom left, we're showing the sleep metrics for the fourth year students. And our hypothesis on this is that maybe second years are becoming more familiar with the academic curriculum associated with medical school, so it's not as stressful, and they're able to sleep more than they did the first year when they're just getting used to the demands of medical school. And then third and fourth year metrics being the worst out of the 4 years, our hypothesis is that maybe the demands of clinical rotations and residency applications and residency interviews is a little more demanding, time-consuming, and stressful than the academic years of first and second year. In conclusion, the results from our study do support findings from previous studies that medical students are not obtaining the recommended hours of sleep per night, and that there is an increased rate of poor sleep quality among medical students. Further, due to the identified correlation between poor sleep and increased risk for poor mental health and poor physical health outcomes, we believe that medical student sleep warrants some more investigation. And then, due to the poor sleep habits and the insufficient sleep consequences of medical school, these poor sleep habits could develop into residency and subsequent practices as physicians, and so this is ultimately affecting patient care, which is another important reason we think that medical student sleep should be further investigated. So in the future, we plan to conduct more investigations into medical student sleep habits and behaviors by using surveys, and then we also want to look at academic performance and sleep behaviors using both the surveys and the objective sleep measurements that can be obtained using wrist actigraphy. And that is all I have. Thank you guys so much for joining me for this presentation. I hope you enjoyed it.